Once we got all of our genetic information back, it was determined that Adam and I are both carriers for the same disease, which means that moving forward with any pregnancy, we have a 25% chance of passing along this disease to our baby. And we sat down with Dr. Casey and we had a conversation about family planning and when we were ready. And we both agreed that we needed to do the emotional work first in order to feel like we were ready to try and conceive again.
I think the impact, cannot be underestimated, that regardless of when someone experiences a pregnancy loss, that impact is felt, and the ripple effect of that is, felt within their families. It's felt within subsequent pregnancies. Oftentimes, families will refer to their rainbow babies that they have following a loss and seek the providers who can, give you hope and help you with resources to heal and in your recovery process and moving forward with your family.
So we decided that we were going to try again. We weren't going to pursue IVF. We were going to roll the dice and hope that we landed on the 75% chance that it would be a healthy baby.
And so it took a lot of work between the first pregnancy and when we decided we were ready for our second.
I wanted Dr. Casey to be my doctor. I told her she needed to take me on as a patient, and I was unwilling to go anywhere else.
I really want to offer hope because many circumstances of pregnancy loss are not expected to repeat again. But I also want to encourage that if you feel like you haven't received the answers you need, that you are open and honest about that. It's important that you feel heard and that you feel genuinely supported in your subsequent experience.
So we got pregnant in October of 2018, and we had to go through a CVS test with Dr. Casey at 12 weeks. And another doctor performed the procedure so that we could find out if the baby had the disease or not. And we found out at 15 weeks pregnant that the baby was just a carrier, which meant that our little boy, was healthy.
One of the things that I intentionally provide for pregnancy care following loss is that if their need is to come in more frequently, even on a weekly basis, just to see the progression of the pregnancy and feel more comfortable, that we can honor that. I try to be very available through messaging, as I'm sure many of my colleagues are as well. Again, I think the onus is on us to try to provide the best experience. That labor and delivery experience is happy and exciting, and at the same time they hold this setting where it was a very difficult time for them. And the congruence of those means that the providers in the room should be respectful of that.
When I had my 20-week ultrasound, I told the person that was doing the ultrasound, I need you to talk me through what you're doing. And it wasn't this deafening silence that had happened before. And they were talking me through it and supporting me. And I went to Dr. Casey or Sonia, and I didn't feel like I was asking a stupid question or that I was overreacting. It was more of like, we care about you and your mental health as a mom is really important to us. And I was scared, and I needed people to understand my level of anxiety and fear and to meet me with compassion. And the nurses were phenomenal. Sonia was really supportive in that process. Even when I was delivering, she's like helping me to push the baby out, which was super important to me. Once I had Lincoln, our son, I needed to go back for a quick procedure, and Dr. Casey was very confident and in charge, and I knew I was in really good hands.
Jillian and Adam and I, they are a family who I have had continuity of care with now for a very long time. And also Jillian, being a social worker, recognized also a niche that needed to be filled in the sense that, support groups for loss, need to encompass all kinds of loss and backgrounds. And there are several groups that do that. Not only have we come full circle as kind of a family unit in their healthcare experience, but we've also come full circle in the sense that now she is giving back to patients who are in her similar experience.
Find a care team that you feel most comfortable with. Find people that you know will advocate for you, that will listen to you, that will support you in whatever decisions you make. I would say, continue to ask for help, continue to process your grief, continue to figure out how to balance the grief and the joy, the hope and the anxiety, because they coexist. There's not one without the other, and you have to live in that balance, which is really, really challenging, and it's best to do it with other people who can support you and who've been through it.
We don't know what the future holds, but we know we've put in as much work into our mental game, our physical game, our support staff. We have got our resources ready, and we're going to go for this. But it takes a lot of courage.
Right. I am always so appreciative of everything that they do. I think that they see me as a whole being, as a whole person, not just as a medical patient. And I think that they're so caring and generous with their time and their resources and the way that they show up for their patients. I am really grateful for them.
They genuinely care about you, your specific journey, and what they can do to improve that journey,
Right.
whether it is with our living child or
Right.
Logan.